Alright, we are here. Kinetic. This is where all of my PT work gets done. So finally, we'll get you guys in here to see Jason. He's who's been answering all your questions on Instagram. Anytime you're asking me questions that are well above my pay grade, I shoot a text to the boss. He tells me what to say. I spit it back to you guys. But essentially, he is the reason that I can keep doing what I do, especially the way I do it, and be healthy. So let's go inside. He's going to give us kind of a breakdown of, show you some things that are off on me, fix them, show you again. It's wacky. We do this every week. So come inside, meet the man, the myth, the legend. See you guys in a minute. On my pendulum, and then I said, it's probably enough of that shit when we got to hacks. It was warning me. So I was like, okay. And like, it's not injured or anything, but right here is every rep I can just feel tight. It's valid. He had a hernia surgery like 3 minutes ago, so they sutured him and then we met him here, so I'm straight in. I was like, you done yet? Because we're ready. I got done with my sandwich. Let's go.
Exactly. You know? Let's go on your back for me first. We're going to do a few different assessments. Left side for me, Dustin.
Middle of the table?
Yep, perfect. So we're going to take your leg, come back, let it fall. Yep. So, ideally, we want to be on the horizontal. If the IT band, this lateral quad, is too tight, then it'll float. So let's go to the other side. So, back, and drop it down like that. So you see the difference, how that's nice and flat, versus, go back to the other side, really it's just hanging up in the air, no matter where I go. So, that's why it's feeling so tight.
So what is that?
That is your lateral quad. So, TFL, glute med min, and then anything that attaches to your IT band is going to create tension through the IT band so the leg floats.
Right.
So it's called an Ober test.
A what?
An Ober, O-B-E-R. It's an orthopedic surgeon back in the day. And so that's why you're feeling all that tension.
Right.
Is because all that extra pull is making the IT band kind of tack down.
Right.
And then, so then when you try to go into a deep squat or your normal quad activated stuff,
right, that
extra tension already in here just puts more tension on that IT band, and then there's the pain.
Yeah.
And then right there you can feel it jump as I
it's brutal.
Roll through.
Some of it's pain because I kicked the shit out of it anyways, but I found a way to bring the pain either way. But
yeah, so which was where I was wanting to go with you when we 2 weeks ago before surgery did the little car movement with the hip mobility and all that stuff, is trying to open all this up to give you better unrestricted depth in your squat.
Right.
So that way we don't get a twinge of the hamstring again, anything. So it's probably perfect timing.
So that other thing's only 11, huh?
What do you mean?
The machine. 11,000?
10,005. And then,
do we want it?
I don't know. I'm gonna do I'm supposed to do a call with them on Friday to kind of hear the details. Because how it's different than the new fit is it uses a alternating current overlaid, so an AC current overlaid with a DC current to be able to do more stimulation without risk of burning people. So
you can take it deeper, basically.
So you can take it deeper, right? And so that way you'd be able to put more intensity through the muscle and people train without the risk of burning their skin.
That's amazing.
Or give them rhabdo.
Which has happened a lot, actually.
Has it? Yeah, I mean...
Everyone's being quiet about it, but I know a few.
Well, and that's the thing is if you don't understand, that electric current gets 100% of that fiber going, and you just blast it, and then you overlay, heavy strength training on top of it, because you think that's what you're supposed to do, you're going to end up hurting someone bad. So scraping it first, because you can, as normal with you, there's always a bit of grittiness. Not too bad. Is that coming down there? So I just wanted to kind of prime it a little bit, make it easier for me to come through. Because when I hit you with the cups, I don't want it to be terribly painful because there's a lot of trigger points through here.
Yeah.
And so if I overload you with too much pressure through the cups, I'll piss the trigger points off, and then we might be spending the evening together like we did a long time ago. And then, let's see. I don't know if the camera mic will be able to catch it, but if you get close, Todd, you might be able to hear. That's not normal. That's not supposed to sound like that. It sounds like I'm rolling gravel because of the fascial tightness along the quad. Although a year and a half ago, when we first did this on Dusty, it was significantly worse. But this is the value of using a cup more than just letting it sit, is actually pulling it through the muscle to, you can see how it gets nice and full, but you can see the trigger points starting to kind of activate a little bit. But it helps pull the density apart, which can create more fullness in the muscle, pull out some of the lines, but then kind of unpack it so it's better to grow. But for me, it's going to help me quickly make his legs more supple so that as I rotate him, we'll see that to start to improve much faster. So just doing deep tissue work, which would take forever on these legs. So for me, the scraping is kind of bring a little blood to the area. The cupping is going to decompress it, so we open the fibers up, and then when I go to needle it, I'll be able to feel the trigger points much easier, so I can get a better release without having to poke everything in the leg that feels tight, because that's not very efficient. And then we can go through those trigger points right there, which we can't see, which we should see a jump. Yep, there's the jump. That makes it easier for me to be able to feel it. So then when I needle that, I will be more efficient. Because you know people are going to have a fit about that.
No, because then I don't give a fuck. I state that on the regular.
There we go. So probably, if you stay right in there, we'll see a few little jumps. There's one. There's a big one. There it is. So that's tensor fascia lata, and which is a hip flexor, and the upper part of his quad jumping nicely. Your body's cooperating for the camera, Dusty. It's good.
I told it too. Said have your game face on, body.
That's right. That's right. We're going to go right down the lateral quad and go in behind the IT band, so it'll be more comfortable, because if I go through the IT band, it's a bit sharp in its sensation. It's a little heavier duty needle for the muscle here, so that way, again, we don't have to worry about things bending and getting wobbly in here. So as we say many times, if the muscle was normal, we wouldn't see any twitching, but because of these trigger points down in here that's giving Dusty that sense of tightness, we see all the twitch response, which is optimal for what we want, because that tells us there's a problem deep inside there. And if it stays, then that's where we run the risk of a big injury versus just, I feel a little tight. Again, see it balancing very well there. There it goes. You okay, Dusty?
Yeah.
Anything crampy?
Nope.
Okay. Down again, vastus lateralis, going about 2.5 inches down into the muscle belly behind the IT band, which we can see the quad flex there, which would make you think the IT band is flexing, but it's not. It's the quad twitching behind it, creating that jump sign. There's the needle, very tiny. But these are a thicker bore, so they can handle. We don't run the risk of breaking one off inside Dusty's quad, which would be a bad day of work. Ooh, that's got to feel the IT band a little bit there. You okay with that, Dusty?
Yep.
So we bring the leg up, going across the body.
There we go, ninja.
Yeah. So, in most people, I would like this to go 10 degrees past the midline, but your adductors are so big, you just run right into the soft tissue. So for you, as long as we have that, then as you're going into flexion, hip extension, we're going to have no restriction through the hip joint to where we have to worry about you tearing something because things can't move close to anatomically normal. See if I did my job. And there we go. So now, dead on the horizontal. So what we're going to do is do a little bit of stretching there. So Dusty, push your knee up into my hand. Good. And then relax. Is that okay on the knee?
Yeah.
Push up again. So a little contract, relax. Relax it for me. You can see the knee just dropping low without much effort. Push up again. And then relax. There we go. Below the horizontal. Again. Perfect. Okay, now back on your back. And straight. And then, yeah, now we're coming across the body. Pushing me against my hand. And relax. Am I crushing you?
No,
Push again.
there's nothing there to crush. Drugs, my friend, drugs.
And one more time. And relax. Good. Good. So we look at this. So Todd, come back from that shot. Again, you can see how good it is now. Now watch when we do the other leg. Let's see how tight this other side is. That's it. No matter how much I push. 0. So, gotta get you even.
Back to the other side.
The leg test, just to see if just releasing the quad made a difference in that test at first, which, yeah. So now we're just slightly above the horizontal where he was floating up there in the beginning, and then we're gonna come through the glute and the little upper part of the TFL, glute med min max. That'll help that drop the rest of the way. That tension point now through the middle of the IT band should be gone. So he'll live another day at the Humbler. Which, what are you going to do when you run out of people to stand on it and weights?
We're trying to figure that out. But at some point, we're going to actually have to secure it to the ground, I guess. So it's going smooth.
So this bulk right here is his TFL, which is a hip flexor and a hip abductor. So it gets very tight with when the quad gets tight. Likes to compensate for a weak glute. And And so sometimes, I didn't test it today, but sometimes when you'll get this stuff mid-quad, if I tested his hip abduction, it would be actually weak. Inhibited, not truly weak.
It does not hurt. A couple weeks ago I fell asleep while I was working on it, but
So right here, Todd will see it. TFL starting to fire right there. Bam. For those who struggle with like hip pain, weakness, as a competitor, if you don't get these muscles released, you'll start overusing your external obliques as hip stabilizers, and you'll get a very thick waist. So a lot of the competitors I see, we have to work a lot with TFL and the glutes to get them to reactivate so they don't build a wide waist incidentally because of their compensating for the weak hip.
I knew yesterday, I was like, this is just something stupid that needs to open up, but I didn't feel like it was a good idea to press it. I was like, I think we're going to call that smart for the
So
day.
what did you do, like just humbler and...
So we did humbler, and then I was going to go to the hack. I only went up to like 5 or 6 plates on the hack aside, and then I was like, all right, we better not. Then we did extensions, and then I did the split squats, but the drop set, so 80, 60, 40, nothing crazy.
That's how tight his leg is. So there's his IT band, that dividing line between his hamstrings and the lower part of vastus lateralis. You know, that's from the tension through there. But that's a good start.
Awesome.
Okay.
All done. Back in business.
Yeah.
To the humbler. Ninja.
Anything twitchy? Anything sore? No cramp?
Just tight like the usual. Okay, done.
Nothing.
No pain. All right, so we are here at Kinetic Sport and Spine, and today what we did was Jason actually just finished therapy on me. I came in, as I do every week. I either come in because I have an issue I'm dealing with, or we're trying to stay ahead of issues. One thing that I press a ton to you guys is do not wait to see your PT, your massage person, or anybody until you're hurt. Now you're behind the 8 ball. So what I actually tend to do is come in here with no issues.
Yep.
Jason then follows through, checks out my body, and keeps me ahead of the game. Yep. And by doing the testing that he does, the different things, he can actually see where things are gonna be coming if we don't get ahead of them. So that's where you wanna be if as much as possible. Today I happened to come in, had a slight issue because we've been working on my upper body so much that I actually got a little behind. But the good news was because of the previous work he'd done, it was a quick one and done fix. I was in here for an hour, knocked it out. I'll be back to training 100%. And that's the key. So if you guys get a chance, make sure to check out his Instagram at the bottom of this so you guys can check it out. Follow him, follow me. We'll keep questions going. And if you're in Arizona, I don't care how far you are away. If you're not driving to see Jason to get fixed, you're an idiot.